Hello, everybody. Welcome to this episode of our podcast. Today's episode is about wisdom teeth or third molars. Certainly a lot of nicknames seem to be sort of a rite of passage for everybody in their growing up years. And today's guest, I have Dr. Jeff Beattie. He's an oral maxillofacial surgeon. He's one of the certified specialists in the dental field here in the United States. And I'm really excited to have you on to talk about wisdom teeth. You handle wisdom teeth probably every day, and I really want to get your thoughts, what you suggest, and kind of how people manage wisdom teeth, because there's a lot of people that ask me questions, and I have a lot of questions for you today. So let's just get right into it here. Tell me briefly, wisdom teeth, what are they? How many do we have? Any reason why we have them? How many do we have?
Sure. The main question that I normally get asked is, why do we get them out? Actually, there's a number of reasons. The first and most common reason is when there's pain and inflammation. And that happens when wisdom teeth are trying to come through the gum tissue. And so the gum tissue gets inflamed, something called pericoronitis, which is a $5 word, but it creates a lot of tenderness and discomfort, I should say, to patients. And when they experience it, they come into our office. Another reason is if there's not enough room for those wisdom teeth to erupt. So there can be issues if they're not going to be functional, which means actually an occlusion with the tooth above them, or vice versa, the tooth below them can't function, then that's another reason to consider getting them out. Other reasons are if they're positioned at less than an ideal angle. In other words, if they're horizontal, if they're 45 degrees instead of being straight up and down, then there can be a risk of damaging the second molars, which are the teeth right in front of them, and you don't want to worry about hassles with those teeth if you can. Cysts can form around wisdom teeth. That's another particular issue. And also, if the wisdom teeth actually have room to erupt, there can still be periodontal disease or gum disease, as the layperson knows it, and there can be decay that occurs in those wisdom teeth. So those are a number of reasons why people can have their wisdom teeth
I know the most common thing for me is people that do have them and they can't keep them clean. They're gagging, choking themselves. It's constantly an area that I see decay in adult patients. So more or less, what percentage of people, I hear a lot from patients, well, I'll just wait, I think they're going to be fine. My mom was okay. Is there a sort of ballpark number as far as its statistics as to what percentage of people can keep them lifelong?
Yeah, that's a great question. I don't think there's a definitive answer, but what I do know is that studies have shown there's 80% of the population that have all four wisdom teeth. Now, there's 5% of the population that have zero wisdom teeth, and those are what I call evolution in progress. So those people are
they Florida State Seminoles?
They're ahead of the curve. I would like to think they are, but there's probably a lot of Gators and Alabama and Auburn fans, and actually Mississippi fans now, I think, would agree that they'd be evolution in progress, and certainly SEC they are. But those studies have shown that, again, 80% have 4, 5% have 0, and the 15% in between have either 1, 2, 3, or more than 4 wisdom teeth. And of those 95% that have 1 or more wisdom teeth, I would speculate, and studies have shown, that anywhere from 3 out of 4 to 4 out of 5 people need at least 1 or more of their wisdom teeth out, which means 75 to 80% of the population will need at least 1 or more of their wisdom teeth out.
So if you're watching this and you want to play the odds are against you. If you're in the, let's just say conservatively 70% or so of people will end up having, whether it be the cyst like you talked about, or decay, or it's sideways, or gum disease.
Absolutely.
So that's what you see. That's kind of, in practice, you see 7 out of 10 people are having problems.
On a daily basis. And quite often we do get patients that come in and ask, hey, do I have problems with wisdom teeth? And in many cases, they don't apparently have them at that particular time, but as we mentioned before, if the general dentist, if they're following through their general dentist, they can identify there's going to be a problem, and it may not be happening now, but a problem could develop if you continue to wait.
Well, it's like a vaccine as a kid. You don't wait to have measles and mumps and rubella. So in an ideal world, again, you're a parent watching this, what age are you seeing? Because for me, I see it normally like a rite of passage in high school. They have like their SATs, they want to graduate, they have to get their wisdom teeth. It all goes in line. But what is the ideal age for men and women, boys, girls, whatever,
Sure.
if in a sweet spot, if you had to kind of draw some sort of a broad stroke?
Great question. Did I get asked a lot? And especially parents that have been referred by their general dentist. There is no perfect age. Actually, ideally, the best time to consider patients having their wisdom teeth out is when the general dentist has identified a potential issue, whether there's symptoms or not, but especially if there's not. And that can be anywhere when the roots are 1/2 to 2/3 of the way formed. So developmentally is really when you want to identify when an issue is going to happen, if there's not enough room for them to come through. And that can happen at age 16 to age 21. So everyone develops at a different age. A lot of times patients will ask me, and the parents will, okay, do girls have to have their wisdom teeth out before boys? There's no difference. It's all developmental. So it depends upon what the x-ray shows, whether they're having symptoms or not, whether there appears to be enough room or not, and then you move forward from there.
Cool. I did not know that. That's great. So, and then the other big question I get, so can they crowd your teeth? A lot of people, they're coming out of braces, and they say, well, I got to get my wisdom teeth out because I don't want them to make my teeth crooked, or vice versa. They have crooked teeth, and they say, boy, my wisdom teeth came in and made them crooked. Tell me what science is out there for that.
Well, actually, there's a lot of controversy involving the crowding issue. And there was one study done by an orthodontist back in 1961, and that had a particular cause and effect that showed, hey, there are some horizontally positioned wisdom teeth, and we've noticed, and then patients started having crowding. Since then, there were subsequent studies that were done, actually by orthodontists too, I think, that refuted that and showed that no, there is no correlation between pressure from wisdom teeth and crowding teeth in the front, be it bottom teeth, be it top teeth. What I like to consider myself, and I'll give you a personal example in a second, I think that lip and tongue posture and muscular issues and habits that may occur with the tongue and the teeth and the lips probably contribute more to crowding lower front teeth than horizontally impacted wisdom teeth. And as a personal example, I had my wisdom teeth out 30 years ago, over 30 years ago. I won't tell you exactly how old I was, but 10 years ago, my lower front teeth started to crowd. What was causing that? Obviously not wisdom teeth.
Right.
So I'm a personal believer in the fact that getting wisdom teeth out for crowding issues is not a good reason to do it. There's much better reasons to get wisdom teeth out than to worry about crowding of your lower or upper front teeth.
Well, it sounds like the orthodontists can't make up their mind anyway. They have different studies. So, and what do orthodontists know anyway? So we just ignore them half the time. No, I'm just kidding for any orthodontists watching this. Okay, so now you're past 16, 21, and certainly there are people out there that are watching this that I want to keep them. I know even culturally, I've heard certain cultures, they feel against taking out your teeth. They this is something that was given to you by nature or whatever have be. So you wait till it hurts. You wait till you're 30 and 40. What is there a drawback to that?
Yes and no. To be honest with you, I see patients daily in their 30s, 40s, 50s, even in their 60s, and heaven forbid, thankfully only a handful of patients in their 70s or 80s, but there are a few. Patients in their 30s, 40s, 50s who never got around to taking their wisdom teeth out. And because of whatever reason, they came through and they were fine at the time, or they just ignored them, or they didn't have any symptoms with them. But symptoms did develop. Okay. And especially on the lower wisdom teeth. The top ones not so much, unless they're creating periodontal issues or decay issues in the tooth in front of them, especially those lower teeth. The older we get, the much harder it is to heal from an invasive type procedure to get those wisdom teeth out. So it's much more difficult and much more challenging for patients to deal with it in their 30s, 40s, 50s than it is in your teens. I mean, we heal like champions, like gods when we're in our teens.
Sure.
But not so much as we get older. So it's important that patients follow through their general dentist and get evaluated, periodically, and make sure that those teeth aren't causing issues.
So the risk isn't so much the challenge you have getting it out per se. It's more as you get older, you have health problems, and that's the risk you take. In your 60s, 70s, whatever, 50s,
well,
you just don't heal as well.
Yeah, there's no question about that.
Okay, so I got to brag a little bit. I know you're a big Florida State guy. Florida State, Notre Dame, huge game. Florida State did finally win. But, recently Google, this is kind of, I don't know, very, very convenient. Recently Google, I don't know if you knew this, Google came out with their top search universities, okay?
Yeah.
Harvard was 15. Harvard, 15. Guess what was 14?
Are you going to say FSU?
Florida State, number 14, Harvard, 15.
Okay,
So it's crazy. I think now we can officially call Florida State the Harvard of the Southeast.
Yeah.
But with that being said, here's one more piece of trivia. What was can you guess the number one search school in the nation on Google?
The number one search school?
Yes. So Google. Yes.
Please don't tell me it's FSU. Please don't say that, because I don't want FSU to be searched. And if it is, it's only because of Jameis Winston.
No. Florida State was 14. I'm saying Florida State was 14. Okay. Harvard. So Florida State edged out Harvard.
Okay.
So that's huge. More people are searching for Florida State than Harvard. And now, what do you think was number one? This is a total sleeper. Did not see it coming myself.
Number one, Wesley College.
I don't know. University of Phoenix. University of Phoenix. Two out of the top 5 were online universities. People are looking anyway. So that's that. Maybe soon enough you can just take out wisdom teeth online. But
I'm quite fine FSU being not in the top 15. We're a quiet. I like to say little school, but it's a huge school. But,
yes, clearly number 14. So top school. Okay, so let's fast forward. We've already talked about the pros and cons of the wisdom teeth, and I want to talk about now I'm a patient or I'm a parent and I'm taking my kids to get their wisdom teeth out. I'm taking them to an oral surgeon such as yourself. Most of the time, are most of your patients for this asleep? Is that your common wisdom?
Yeah, that's a great question. The majority of patients that come into our office will talk about having it done, and the best way to have it done. Patients, as far as I'm concerned, can have it done any way they want. They can be awake, they can have nitrous oxide, they can have sedation. The challenges are, if you're awake to have it done, which is probably less than 5% of patients, it's not a very enjoyable procedure to sit through if you're awake. I mean, there's lots of shots that you have to put up with. There's lots of pressure, lots of noises, lots of sensations. So the whole concept of sitting there and kind of white knuckle holding on through the whole process is not great. So the vast majority of our patients prefer to be sedated, which I think is the best way to do it. Now, as a quick clarification, when we talk about sedation, many patients are confused and they assume it's something that's similar to done in the hospital, where you have an anesthesiologist that gives you medication, you stop breathing, a tube goes into your windpipe, the tube's hooked up to a machine is breathing for you while an operation's done. That's not what we do in our office. In our office, it's an outpatient setting where you're sedated, where we give you medication. And it's just like a colonoscopy. Any parents who are watching this, if they've had a colonoscopy, they know exactly what's done. We give you medication. You get very sedate, very sleepy, but you're still breathing on your own. So there's no machine breathing for you. Everything's completely normal, and your breaths are fine. We still have EKG pads on your chest. We still have a blood pressure monitor that recycles every several minutes. There's a pulse oximeter, which is on your finger. There's oxygen via nasal cannula, so you're wired for sound, and you're in very good shape. But it makes the whole procedure much more comfortable and enjoyable. So I prefer patients have a positive experience, which is what happens with sedation. They're smiling when they wake up, rather than a negative experience like, thank God, I made it through that.
I think your lab back there might be sedated. He seems pretty pleased.
See, behind me.
Yeah.
Oh, there he is. Yeah.
I think he's sedated. So I get it. And that's oftentimes referred to as twilight anesthesia. And that's part of your training, your oral surgery training, your anesthesia training. And I'd say most oral surgeons, at least in my experience, would agree and have the training for that, right?
Yeah, we do 4 to 6 years of training, depending upon how much post-dental school training you get. 4 to 6 years of experience with sedating patients. So it's a very safe, easy, comfortable way to do it for patients.
So now you're coming out of. Now you're done. You just wake up, and we all got the classic chipmunk. Everybody's probably I lived through it. You did 30 years ago or whatever it was. So what should people be expecting there as far as healing, and then of course we all hear about the dreaded dry socket. So tell me about after.
Okay. Well, first of all, the main thing patients ask about, and I like to tell them, is that if they have all 4 wisdom teeth out, the top 2 wisdom teeth usually are in bone that's much more flexible and bendable is what I call it. And so if we're able to kind of flex that bone, those upper teeth come out in one piece. So in most cases, the patient's upper wisdom teeth come out without causing much swelling or much discomfort. So the majority of patients do very, very well from the top 2 wisdom teeth. Now the bottom 2, depending upon the depth of impaction and how deeply embedded they are in the bone, it's a whole different scenario. If they are impacted, then we usually have to use a little drill and feather away some bone and remove the bone and section the teeth so the teeth come out in pieces. What that does is it causes the body to respond by swelling up. Okay. So it's a classic chipmunk type cheek approach where you get really swollen. The swelling starts about 12 hours and it peaks at about 72 hours. So there's anywhere, depending on the depth of impaction, I will tell patients expect 3 to 4 to maybe 5 days of swelling.
Wow. But
the one thing that helps a lot is ice. And we give patients a sexy little Velcro ice pack that they wear around their head.
Like a helmet.
Yeah, it looks very nerdy, to be honest with you, but no one likes wearing it, but it helps significantly. So the more they wear that for the first 3 days, the less swelling they have. And so that's an important thing.
And then they're keeping it clean. Clearly, they're brushing. I think you recommend brushing after the first day, the first night.
Yeah. Hygiene-wise, and before we get into dry socket, I'll talk about hygiene-wise real quick. Besides dry socket, the second most common concern that we have as doctors is infections. And infections, ironically, don't show up for about 3 or 4 weeks. And the reason they show up is if patients are not taking good care of their oral hygiene. And the reasons why, because they're swollen, their opening's limited, it's hard to get back there, and so they just kind of say, ooh, this is not something I want to do, I'm just going to stay away from it. Well, it's extremely important, and we really emphasize this. Patients need to get in there the day after with saltwater rinses 3 times a day, Listerine or scope rinses also 3 times a day, and even brushing their teeth and gums, even the back. Wow. They don't have to go to town with a toothbrush, but gently, lightly brush that gum tissue to get that bacterial film off to minimize the amount of bacteria that can get into the sockets that can cause an infection. Okay. So the more aggressive they are for the first 2 to 3 weeks, the less chance they have of getting an infection. So that's a big emphasis.
Careful. They have to take extraordinary care, which makes sense. You have a wound. I mean, that does make sense.
And it's the lower teeth that get infected. The top ones don't. It's always the lower ones that get infected. Now, back to dry socket real quick.
Sure.
Dry socket is where you lose the blood clot prematurely. So usually if it's going to happen, it's around day 4 or 5. And it's always the lower sockets again, not the top sockets, just like infections. Top ones do great. Bottom ones are usually the culprits if they're going to cause some issues. Dry socket is nothing but pain management. It's not an infection, so it's just dealing with the discomfort. And dry socket can be mild, it can be moderate, it can be severe. If it's mild to moderate, you just kind of ride it out. If it gets better on its own, you take the pain medication that's always prescribed and things get better. If it's severe, patients know it. They end up coming back in our office saying, hey, I'm having throbbing, it's going up to my ear, it feels like an earache, what's going on? And that's because the blood clot's been lost, there's a bare exposed bone, and when that happens, then we can help the severe dry socket patients by packing the socket with this medicated gauze, which is coated in oil of clove or eugenol, which is gently tucked in the socket, which is placed in there and releases that medication and soothes the inflamed bone. So the bone inflammation goes down, the discomfort goes away within 15 to 30 minutes. So it's a very good way to deal with it. Now, the people who get it most are smokers. So anyone who's smoking, the smoking sucks the blood clot out, the nicotine tobacco inflames the bone, and they have a very, very high level of discomfort.
Oh, so that's the major players that are getting it, the smokers is who you see it.
Yeah, the majority of patients who get it are smokers. Now, non-smokers can get it, all right? So don't get me wrong there. But if they do get it, it's much less intense than smokers. Now, the other group of patients that can get it are women on birth control pills. And the reason why is estrogen can sometimes cause dissolution or dissolving of blood clots, and that can happen a little bit more than we like. So many younger women on birth control pills will get dry socket too.
Wow, that's good information. Well, that's great. So I have one more question. Again, this is the most pressing question I have here. I know you're a big swimmer. You're into more Florida State. I get it. But I know you come from a huge family of swimmers. Your dad's a swimmer. Your brother's a swimmer. All swam in college. So big swimming in the family. I know you swim regularly. And I know you did your oral surgery residency out in San Francisco.
I did.
So my question for you, is it harder to take out wisdom teeth or swim from Alcatraz to the San Francisco Bay?
That's a great question. I have actually been in the San Francisco Bay, and the temperature was approximately 63 degrees. Now, I've never swam from Alcatraz to San Francisco. If I get brave enough one of these decades, maybe I'll try it. But I would much rather take out, instead of wisdom teeth, than get my butt in the water and do an hour or 2 hour swim from Alcatraz to San Francisco.
And I think the Aldine brothers would agree, because they're 2 out of the 3 people that broke out of Alcatraz, tried to swim, and they're still out there 40 some odd years later. Nobody's found them 2, and there was one other one, I can't remember his name. So I think they would have rather take out wisdom teeth.
Well, I think, Clint Eastwood, I think, is the one who did the movie on them. So Clint's probably out there swimming still right now, and I think at 84 or whatever he is, he would probably kick my ass on that swim. So.
Well, listen, I really appreciate having you. This is a big topic. I'm so grateful for your time. It's Monday night at 8:30. You're obviously so much of a dental geek that here you are on Monday night at 8:30 talking about wisdom teeth. Can't get enough of them.
There you go.
I really appreciate it. Anybody here is watching this, I hope you learned something. Feel free to post some comments on this. I will do my best to answer them or get them in the hands of Jeff to answer them, or whatever we can try to do to inform the public of what you do and what to expect from wisdom teeth. Thanks again, Jeff. I really appreciate it.
Thank you very much, Ramzi. I loved it.